Hello, everyone, and welcome to the Multiple Sclerosis Association of America's webcast, Advancing Knowledge of Aquatic Exercise and MS. My name is Peter Demiri, and I am the Vice President of Programs and Services for MSAA, and will be your host for tonight's program. MSAA is proud to bring you information on this exciting wellness approach to MS, and very honored to have an expert in aquatics and MS with us for tonight's program. At this time, I would like to introduce our guest presenter, Michelle Harrison. Michelle is a physical therapist, certified MS specialist, fitness instructor for the Aquatic Exercise Association, and hydrotherapy coordinator for the Rocky Mountain MS Center in Denver. Michelle, thank you so much for being here and sharing your expertise with us. Welcome to the program.
Thank you.
Well, tonight's webcast is part of MSAA's new national initiative known as Swim for MS. Swim for MS is a two-part program where we are encouraging water-based exercise as an option for people with MS, as well as giving volunteers who enjoy swimming a chance to create their own swim challenge to raise money to help the MS community. The monies raised through Swim for MS fundraisers help support MSAA's services, including this new aquatic exercise program. The goal for the Swim for MS patient program is to increase awareness, understanding, and availability of swimming and aquatic exercise as a positive wellness opportunity for the MS community. I would also like to acknowledge and give special thanks to our Swim for MS sponsor, Genzyme, a Sanofi company. Through this collaborative sponsorship, MSAA is able to bring you tonight's webcast, as well as a variety of other educational materials for MS patients and healthcare professionals. All of this new content is posted on our online aquatic center, swimforms.org, which includes a section for healthcare professionals. And the guide that you see here is on the site and was co-authored by Michelle Harrison and written in collaboration with the Consortium of MS Centers and the International Organization of MS Rehab Therapists. This next slide is to give you a quick overview of the additional programs and services of MSAA and to let you know that we welcome any patient referrals you may have for people in need of our services. So at this time, it is my pleasure to turn the program over to Michelle and have her begin tonight's presentation.
Thank you, Peter. I want to say thank you to everybody tuning in to this webinar. I get to speak on two things that I really love to do in physical therapy. That's work with people with multiple sclerosis, as well as engaging them in aquatic therapy as a form of exercise for fitness and wellness. So we have a lot of information to cover in this webinar, so I'm going to jump right in. We will start with a real brief overview of what MS is, and then we'll just move into the importance of exercise for people with MS and aquatic exercise. So multiple sclerosis is a demyelinating disease of the central nervous system, and it is characterized by unpredictable relapses and remissions. It is a leading cause of neurologic disability, the leading cause of neurologic disability among adults. It is the primary cause of neurologic disability in women between the ages of 20 and 40, and the second leading cause of neurologic disability in men between the ages of 20 and 40. They estimate about 400,000 people in the United States have MS. Symptoms are variable with MS, and that's one of the characteristics of MS. Things change from the initial diagnosis. Symptoms can change from day to day. It can change from morning to evening, and throughout the course of the disease. You see a list of symptoms listed below, and these are some of the more common symptoms that people note with MS, but there are others as well. So probably one of the biggest complaints that I hear from people regarding MS is fatigue. And fatigue, there are different types of fatigue. One type of fatigue is just the decreased ability to participate in physical activity for long periods of time, or sometimes for any period of time. There can be cognitive and mental fatigue issues for people. There can also be just a general sense of malaise, that somebody has gotten up first thing in the morning and they're already tired and they haven't done anything yet. Another common symptom noted by people is trouble with walking, gait difficulty. And this is really, it has a lot of different symptoms that can make walking hard for somebody. And that is, there can be problems with weakness. Fatigue can factor into this, stiffness or spasticity, sensory changes, problems with balance. These can all make walking difficult. Spasticity or stiffness can cause pain and can decrease people's ability to move efficiently or make activities or movements difficult. Bladder and bowel problems are also an issue. Memory and cognitive issues. People note memory, attention, concentration problems can be seen with MS. The rate of depression in MS is higher than amongst other chronic neurologic disease processes or conditions. Pain. There can be pain with MS. There was a period of time where it was thought that there wasn't pain with MS, but there can be. That pain can be due to areas of demyelination in the nervous system that cause dysesthesia, or it can be a sense of burning or just uncomfortable sensory sensations. There can be trigeminal or facial pain, neuralgias. There can also be pain due to overuse, underuse, injuries, from compensatory movement or changes in movement patterns to, say, somebody has a normal gait pattern and then they start to get hip or back pain, kind of more musculoskeletal types of pain issues. Visual deficits can also be a part of MS. If the optic nerve is demyelinated, somebody can have optic neuritis, which can cause blindness. Usually this comes and goes. It's a more temporary issue. But people can also have blurred vision, double vision, problems with vestibular ocular reflexes being abnormal. Dizziness and balance are also multifactorial for people. Balance can be due to weakness, problems with endurance, lack of flexibility, a variety of issues, sensory problems. It can also be due to problems with vision, and also speech and swallowing deficits can be a problem for people with MS. So since MS is a disabling and it is a progressive disease, it makes it imperative for people with MS to participate in exercise to improve their overall physical fitness and their ability to participate in home, work, community activities and functional abilities, improve ability to walk, to stand, transfer, and be mobile. There was a point in time when they felt that exercise maybe exacerbated MS symptoms, but research studies have shown that people with MS actually improve functional abilities or levels, aerobic fitness, balance, and strength with exercise programs. It reduces the risk for cardiovascular disease. Exercise also helps decrease depression by helping increase release of endorphins that decrease depression. It enhances quality of life. And one of the bigger areas of interest in neurology lately has been neural reserve and looking at how we can increase neural reserve, making the brain plumper and exercise is one way that we do that. Also social interaction as well as intellectual mental stimulation. The other area that has been of interest in neurology is increasing brain growth hormone and nerve growth factor. These chemicals are released when somebody exercises, and they increase nervous system repair, regeneration, and they protect nervous system tissues. So people with MS may find it difficult to exercise through traditional land-based methods, and this can be due to physical barriers or just even the increase in body temperature, say an increase in body temperature. Many people with MS experience a temporary worsening of symptoms when they get overheated, and this goes away as they cool down again. And the water is a very effective, it transfers heat away from the body well, so it may be a good alternative to allow somebody to be active and not have problems with overheating with exercise. Literature, there are some studies out there on aquatic exercise and MS, and they show that people have improvements in many ranges or many different areas, I should say. Flexibility, improvements in range of motion, improved cardiovascular endurance, and for people with MS, decreasing fatigue levels is big. Improving muscular strength, improving function for mobility, to be able to transfer, to balance well, to walk, and also the areas of quality of life and psychological well-being and decreasing depression. And none of the studies showed any exacerbation of symptoms or adverse changes in neurologic status with aquatic exercise as an exercise option. But I would like to add to that I would like people to think of aquatic exercise as something that could be done early on for somebody with MS, somebody very active. We can work on lots of different aerobic strength training activities. Even world-class athletes utilize the pool for cross-training and rehabilitation themselves. So I would like aquatic therapy not to be thought of as kind of the last thing that you try because other options didn't work. It may be one of the first ones that you try. As with any exercise program, we need to do an assessment to start a program, and it will help provide information on a kind of a snapshot, a current functional status of that person, that individual. And it may identify other health issues that may present as precautions or contraindications for exercise in the water, in the aquatic environment. And it can also provide information on how to start a program, what the goals might be for the program, to individualize it, to be able to utilize a person's resources in that area, in their community, so that they can fully participate in the exercise. If you're doing aquatic physical therapy, you need, and you're going to be billing insurance, you need to do a land-based assessment. And a lot of that information can also be utilized and fed into some of the aquatic templates, assessment templates that are available. And if you're going to be billing insurance, again, you have to have land-based goals. to be able to document for insurance reimbursement. Special attention needs to be paid into the areas of neuromuscular and musculoskeletal systems for people with MS, but somebody living with MS may also have other health issues, problems in other systems. So it's really prudent to screen for other health issues as well. There are some commonly used tools for aquatic assessment. The top three, the Aquatic Exercise Review System, the ICF, and the WOTA, the Water Orientation Test. These are all there are templates of those in Lori Tyne-Brody and Paula Geigel's book, Aquatic Exercise for Rehabilitation and Training. So the Aquatic Exercise Review System looks at a variety of systems, again, neuromuscular, musculoskeletal, but also cardiovascular, psychological systems. It gives you tests and measures to, again, begin to assess the person, what their particular needs are, how you would design that program, and then be able to look at the changes of those over time through the treatment program. The ICF checklist is the International Classification of Functioning Disability and Health utilized by the World Health Organization. This framework describes and organizes information on functioning and disability. It also gives a conceptual basis for defining and measuring health and disability. It uses 4 domains usually: body function and structure, activities and participation, but also factors in personal and environmental factors into being able to design programs. The water orientation test is strictly a water skill safety test, and it starts with the ability to enter the pool, to blow bubbles, all the way up to basic swimming skills. Andrea Salzman of the Aquatic Resource Network has designed a Berg Balance Test, an aquatic Berg Balance Test, and it's available on her website. The Aquatic Exercise Association also has a training manual for fitness instructors, and this has a health risk appraisal template and a physician's consent form, which are important to have for starting an aquatic program. And these were included, and we modified those for some issues pertinent to people with MS as well. And those are appendices within the manual, the Aquatic Exercise and MS manual.
And Michelle, I just wanted to jump in and say, as I showed in the earlier slide, that manual is available on the MSAA website in the Swim for MS section and the healthcare section, and it's free of charge and can be ordered with a simple form to be downloaded and sent back to MSAA. So we encourage people, if they're interested, to go on our website and check it out.
Exactly. So when we are looking at water as an exercise option, it is as broad and varied as the people that may want to participate in this exercise option. There are so many, and there's a myriad number of treatments and exercise options available, and it's really only limited by the knowledge and creativity of the aquatic therapist or aquatic exercise professional. But it really is important for anybody who works in water and works with patient clients to have a solid foundation of aquatic physics and hydrodynamics to get the best result from participation in a water exercise program. So our next section, we're going to look at the physical properties of water. The first property is buoyancy. And that is the sense, if you've been in a pool, you walk in a pool, you feel lighter in the pool. That's that uplift force. And it can be helpful for some people to decrease weight bearing, either due to pain issues or just weakness. That may enable somebody to move more independently in the water than on land. It is that uplift force, that movements towards the water surface are easier than a land activity. So if you lift your hand up, you lift your leg up in the water, that feels easier up towards the water surface. So buoyancy can be assistive up towards the water surface if you have a movement that works where you're moving along the water surface, kind of parallel with the water surface. That could be a supportive motion, or motions down to the pool floor are resistive. And those can all be used to somebody's benefit in an exercise program. This property of buoyancy may also increase the ease of assisting somebody with MS with exercise or activities. The next property of water is relative density, and this is whether an object floats or sinks. If the relative density of an object is more than the density of water, then the object will sink. So a very muscular limb or a limb with spasticity will sink. Conversely, a person that has a flaccid limb with relative density less than water will float. And why is this important for us as exercise and therapists and aquatic exercise professionals? Well, what it does is it is really going to influence what activities or exercises we choose for that person because of their specific density, the position that they're in, the postures that we choose for them to work in, the depth of water. We can make activities easier or harder because of that. And also it's going to have a bearing on equipment choices. What kind of equipment we choose to use with somebody, how much flotation we put on somebody or we don't. We can make an exercise very difficult for somebody by either too little buoyancy or too much for them. So we need to think about that as we are designing these programs. The next property of water is hydrostatic pressure. And I would like to add at this point that all these properties, you can't work one without the other. So they all kind of work in tandem. So, and you will see how that works well for some different exercise techniques and activities in the next section. Hydrostatic pressure is that the fluid exerts pressure. All fluids exert a pressure in all directions. So the deeper a body is immersed in water, the greater the pressure. An example is if you have ever dove into the deep end of a pool and you try and go down to the bottom, you feel a whole lot more pressure as you go down in that deep end. That is what hydrostatic pressure is. That pressure causes a centralization of blood from the limbs to the chest. And that could make the work of breathing more difficult. And this may be not necessarily a contraindication, but something to be aware of if you bring people into the pool who have significant respiratory or cardiovascular compromise. It could make somebody feel short of breath or fairly anxious. So when a body is immersed in water, because of hydrostatic pressure, there are also changes in kidney function. And so, again, this isn't a contraindication, but you may need to be aware of this if you have somebody with kidney problems or limited kidney function. So there are also positive aspects to hydrostatic pressure. Those include it can help stabilize somebody to walk, balance, and stand easier, or increase their ability to do those activities when they may not be able to do any of that on land. It can also decrease edema for somebody, and it may decrease pain and hypersensitivity, which could make somebody more active and more successful with their exercise programs. And the hydrostatic pressure, we could use that to our benefit to help train weak respiratory muscle function. The next property of water is viscosity. And that is a measure of a fluid's resistance to flow. So what does that mean? That means that there's an attraction between all molecules in a fluid. And the greatest of that is at the water-air interface. And different fluids have different amounts of friction between the molecules. And this is a sensation that water is thicker and heavier to move through than air. So if you move your hand back and forth in the air side to side, there's no resistance to that motion. However, if you did that same motion in the water, you might notice it feels thicker or heavier. That's what viscosity is. And we can use that for balance activities, higher level skill training activities, because when a body is submerged in water, it will experience resistance when it moves. There's a linear increase in speed and surface area as the movement of the object increases in the water, and we can use this to either increase or decrease exercise or activity difficulty. One other point to bring up for viscosity is because there is increased resistance at the water surface, if somebody has a weak or painful shoulder, you may or may not, depending on where you are in your treatment planning or your program, you may not want to have the person break through the water surface or do it on multiple times. At the end of a training session, if you're really trying to train strength and endurance, it may be appropriate. It would depend on the person and the goal set for that particular person. Refraction and reflection. So refraction is the bending of light rays from a denser medium such as water to a thinner medium such as air. And why this needs I bring this up is it can make being able to measure movement and positions kind of difficult if you're out of the water and they're in the water and you're trying to get accurate readings on something. So just being aware of that, and I'll show you a picture that I think is interesting after this slide that kind of illustrates that. Reflection is also the change of the direction of a light wave between two surfaces, say air and water. So we need to be aware of reflection because that can trigger problems with dizziness. It could cause problems for a person more prone to seizure activity. And so we can try to decrease the effects of that for somebody by lowering the lighting in a facility, using sunglasses, maybe having somebody focus on an object outside the pool that isn't moving, that doesn't bother them. Some people, because of their visual problems with MS, may notice often fluorescent lights bother people. So being aware of visual issues that may influence somebody's ability to participate is important. So here is a picture of two of us standing upright in the pool. And it really looks like in this slide that we're bending forward, but we're not. We're standing upright. So that's just an example of how the refraction can change what position it looks like that you're seeing the person that's submerged in the water, kind of what their posture is and what position they're in. You can also see a bit of the reflection, and you can imagine somebody with lots of visual problems and issues, how that might be an issue if there was lots of reflection in the water surface.
That's really interesting, Michelle. Now, if you have an aquatic fitness instructor and they're trying to look down into the pool to see how their students or the class is doing, are they able to compensate for that and kind of gauge whether the class is moving the way she's instructing them to move?
I think if somebody is aware that they're of the bending of light rays, you can kind of compensate for that in being aware that you may need to change position, you may need to get closer to the person. It could be possible that you need to get in the water next to them and do an actual measurement if you were doing therapy. But I think as you become more skilled in realizing what somebody's position looks like in the water, you can not have that be a barrier to having accurate position sense of the people or measurements.
Right, right.
The next property of water is the thermal transfer of heat. We touched on this briefly earlier. Water it retains heat and transfers heat much more efficiently than air does. And that's what makes it a useful medium for therapeutic benefits, particularly for people with MS because they tend to not tolerate heat as well. The idea of the transfer of heat is important if the water is the correct temperature. It can help a person to stay cooler during an activity or exercise. So recommendations for people with MS are generally to have water temperature 86 degrees or below. Usually your extremities are about 93, so that feels cool to you when you get in that water, and your core temperature is higher, of course. But the National MS Society recommends 81 to 84 degree water. Now, if somebody is very lean or they aren't very active in the water, they may really find that they get chilled and some people talk to me about they get stiffer when they get chilled in the water. So that's when I would utilize either a wetsuit or a vest, a neoprene vest or a cap or something for somebody to utilize the coolness of the water but not to become chilled. So again, they can be successful as well. Water in motion. This is kind of a complicated issue in water, but and for the use of water to provide opportunities for balance training, coordination training. But I'm going to try and really simplify this down. So when water moves, all the molecules move in one direction, and it's a steady, continuous flow. We call that streamlined or laminar flow. Turbulence occurs whenever you have an object that the water flows around, or when the velocity of the water flow increases and the molecules move more irregularly. So this can really increase resistance. This can provide all sorts of opportunities for core stabilization, coordination, and balance activities. So if somebody is in water and they're moving through the water, they're walking, they're causing turbulent flow around them and behind them, partially because their body is an irregular surface in the water. Now, the pressure in front of the person is greater, and behind the body it's less. This low pressure area behind the body is known as a wake, and the water that flows into this area is known as an eddy. So we can use this principle to maximize somebody's ability to be able to stand, balance, and walk. So if you walked in front of somebody with MS, this would create an area of lower pressure behind you and may decrease the work of walking that they're doing. An example of this would be a mama duck and then her little babies swimming behind her. She creates an area of low pressure behind her that almost pulls those little ducks along with her. And so she decreases the amount of work they have to do to keep up with her and to move across the lake or pond that they're in. It's the same concept. So if you walk beside somebody, you might increase the work of walking. So that's a way to progress somebody's walking program. This picture is showing me trying to produce turbulence behind somebody, producing an area that will draw her backwards, that low pressure area. I have her hands on her chest just so she won't be using her hands to stabilize herself. But as she's being drawn back, she really has to use a lot of leg stabilization, core stabilization, to not be pulled backwards by that low pressure area. This technique could be done anywhere around the person. You could change leg position. You can have somebody start with a wide stance, move to a narrower stance, one leg. You could be on one side of a person if they tend to fall one direction, and work on them being able to stabilize themselves from falling over that direction. So that's an example of the use of turbulence. Now we're going to move into aquatic exercise programming. And there are a myriad of aquatic exercise programs to choose from, everywhere from a community-based exercise group to individualized treatment or therapy or a training session. So looking at compliance with exercise, there are problems, and that's been well documented. But sometimes participation in a group may help increase motivation for getting out the door to do that exercise that day. The group members support each other, and that may help with compliance for long-term participation in exercise. And there are any number of techniques and exercise options for all ability levels in the aquatic environment. So what we're going to go through today are just a few highlights, and this is not an exhaustive list of all the techniques that are out there, but I'm hoping that it may stimulate some interest for you to maybe follow up with some of these techniques and get much more in-depth training or spend some time learning about these techniques and the ones that you think might be most appropriate for your clients or patients. The next slide we're going to look at is Hydrodynamics technique and water-specific therapy. It originated in England in the 1950s by a gentleman named James Macmillan. He was a boat builder, and he took the metacentric effects of how a boat floats and applied those to bodies in water, because he initially had wanted to help disabled children have a swim club for recreation. But what the therapist noticed with this 10-point training program that he had the children participate in is that there were improvements in balance, postural control. They were able to participate in activities more, and so it has really evolved into water-specific therapy techniques. It's a 10-point program with 3 stages of learning. So the first stage of learning is mental adjustment. That's actually being able to independently enter the water and maybe be able to put your face in the water and even blow bubbles. The second stage is balance. And any asymmetry in water is going to turn into a rotation. So a sagittal rotation is a side-to-side rotation. That can work on weight shifting, being able to stand on one limb at a time for walking. Transverse rotation would be lying down on your back or floating in the water and then sitting up. And that could help with trunk strength. It could also help with being able to go from lying down to sitting up. A longitudinal rotation, if you dropped a pen or a pencil in the middle of your head and you rotated around that pencil, that would be a longitudinal rotation. And that rotation may help with efficient swimming strokes. It may also help with walking efficiency, being able to do a longitudinal rotation well. for somebody. Combined rotations it's a combination of any and all of the rotations above. And it can really enhance balance, core stabilization, and riding reaction. The third stage is actually independent movement, and you can see it depending on what the goal of the therapy or the treatment session is or the group. It could be swimming, independent swimming. It could be improving balance. It could be transfers, being able to transfer, or improving transfer independence, or even decreasing the amount of assistance needed for transfers. Walking and reaching all could be really good goals for water-specific therapy. So here are a couple pictures. The picture on the left is showing a transverse rotation, so somebody going from lying down to sitting up. This is a great safety skill for somebody in the pool to be able to get yourself upright in the pool. It could also, again, be working on lying down to sitting up transfers. The picture on the right shows a lady performing more of a sagittal rotation, one-legged balance, standing activity, weight shift activity. This, again, is a transverse rotation activity, but it's looking at sit-to-stand transfers using the water, the buoyancy, hydrostatic pressure to enable somebody to go from sit to stand. I'm working on that skill. The next technique we're going to look at is Badvergat's ring method, and it was developed in Switzerland in the 1960s. It utilizes PNF, proprioceptive neuromuscular facilitation techniques, and so it utilizes those PNF diagonals, and they're modified for the water, for trunk, arms, and legs. It improves strength, core stability, and proximal control. I find it useful for people who I am having difficulty to participate in trunk strength because of weakness, or really higher-end clients that need a challenge, because it can be very difficult to move and control your body in some of these diagonals. The patterns and the handholds and the positions are very specific for the best results, and it also requires that somebody is able to follow the instructions adequately to get the best benefit. So the picture on the left shows an arm strengthening technique. You utilize cuffs and flotation to help stabilize or help somebody float in the water as you're moving them around. The picture on the right shows hip external rotation and abduction. This is a difficult exercise because she's having to hold her legs apart while she sits up. So we're working on trunk control, trunk stability, along with leg strengthening. The next technique we'll look at, they are aquatic bodywork techniques, Watsu and Jahara techniques. Harold Dull developed Watsu, and it is a combination. It takes the principles of Zen Shiatsu, because Harold Dull studied with Masanaga in Japan, and then combines those with stretching and soft tissue mobilization techniques. Very effective for stretching tight muscles, to decrease soft tissue restriction, decrease pain, and to promote profound relaxation. Mario Jahara studied with Harold Dull and developed his own style of aquatic bodywork, utilizing a short noodle to improve body alignment and posture. So this is a one-on-one technique and something that usually wouldn't be done in an exercise group. Similarly, Badvergat's technique is a one-on-one technique. Some of the Halowick techniques are actually, they can be individual or they can be kind of group focused. But back to the Watsu technique. In a clinical setting, say if you're doing a therapy program or a one-on-one training session, you may want to begin with 10 to 15 minutes of stretching, soft tissue release and relaxation to get better results before engaging in exercise or functional activities. This is an example of a hip stretch on the right and a trunk stretch called a corner stretch. Seaweed on the left here shows, or actually the movement is side to side in the water. It's real good for spinal, decreasing spinal limitations, and feels good. Most people really enjoy this activity if their backs are tight. This gentleman does wear cuffs for this activity because he's very lean and muscular and tends to sink, so it helps him float for the activity and be able to relax more.
Michelle, it looks like these are techniques that you really would have difficulty replicating on land. It almost seems natural to be doing this in the water, and the properties that you described earlier really work in these settings.
Yes, they are. The water offers a kind of 360 degrees of motion that wouldn't, like a three-dimensional template to work or an environment to work in. And so I find, I moved back a slide, but I'll move forward. You can see the next movements as well. Those would be very difficult to do on land, but help with stretching and mobilization. I find the water is supportive, so sometimes I find better results with tissue stretching. The slide on the right now is a Jahara technique, working through the armpit, working underneath on the shoulder blade and up along the neck and occipital area where the upper trapezius hooks onto the bottom of the skull. Some techniques that are really helpful for decreasing pain, decreasing tissue limitation. This lady on the right had a lot of neck, upper back, and shoulder problems, and the water was the best place to help decrease those symptoms and the pain.
Right.
I Chi is a modified format of Tai Chi that has been adapted for the aquatic environment, developed by Jun Kano in Japan. It is a combination, if you've ever seen Tai Chi done as they do in the parks in China and Asia, it's similar to that, slow fluid motion, but it's synchronized with breathing patterns. The benefits of I Chi include improvements in balance, weight shifting, body awareness, postural control, and stress management. There was a research article written this past year that was done specifically on I Chi and people with MS. And I am not sure if that has actually been published at this point or not, but they actually showed really nice results with the study. It showed that I Chi improved static standing balance for people with MS, improved functional mobility skills, and increased strength and arm and leg strength, as well as decreased fatigue for people. So if you're interested in that, you might try and find that. It was Johan Lombeck from Holland, along with, it looked like the University of Turkey, that students or physical therapists that did this study. The water, because we talked about the hydrodynamic properties of viscosity and buoyancy and hydrostatic pressure, this enables people to stand and do some Tai Chi moves that they may not be able to even attempt on land. the weight shifting, the one-legged balance activities, the full body coordinated activities may be really, really difficult for them, or they may not be able to do Tai Chi unless they did a seated format. And these are a couple movements of a lunge stance, shifting. On the right, if I had a video, which would be a lot more informative for this movement technique, they would beginning to shift back, lifting the forward leg, and then shift forward onto the forward leg, lifting the rear leg. So I think if I did a presentation again, I would really try and get a little video clip because it would make those activities much more clear. The next technique we're going to talk about is a task-oriented approach. It utilizes motor learning and control theories, which became a lot more utilized in the 80s. And the emphasis on these activities is actual full, functional, complete tasks or skills instead of pieces and parts of movement patterns making up a skill. So it is movements you quickly kind of or progress the movements. As somebody masters a skill, you move on to the next one very quickly. So any functional or recreational task could be practiced. It could be walking, it could be stepping over an obstacle to balance, reaching, lifting, household tasks, emptying a dishwasher or vacuuming or making a bed. I have seen people get vacuums and take them in the pool and weight them down so that somebody could work on that task to improve body position and body mechanics so they don't have back pain or fatigue. With doing that activity, you could bring a golf club into, if it was clean, into the pool and work on your swing to decrease back pain or improve, if that was your goal, to improve your golf swing. Same thing with a tennis racket, maybe for shoulder or elbow pain, to work on that swing in that environment. And here are just a couple ideas of a task-oriented approach. One would be stair climbing, and the other one on the right is walking. Aqua stretch is a newer technique in the aquatic arena developed by George Eversole, and it incorporates dynamic stretching with intuitive movement of the person you're working with to decrease edema, pain, and restrictions that may be associated with decreased physical functioning. So the person is stabilized at the edge of the pool with weights to the legs or trunk, depending on what kind of hold you may be doing with them. And then they're told to move as they feel they need to. And then they are to freeze or hold a position where they have restriction or pain, kind of let you know where that is, and you can apply a hold or pressure on that area, and then they move as they feel they need to again until that area is either the pain is diminished or it has dissipated. And you go through a series of these sequences of movements until the pain is, again, either diminished or dissipated. And then we get to some more traditional style of exercise techniques and training. The first one being aerobic and endurance training. The definition of an aerobic activity is continuous rhythmic movements of the larger muscle groups for a period of time that elevates the heart rate, and it produces a cardiovascular training effect. And for people with MS, we're really looking to also decrease complaints of fatigue. And there are a lot of options here for aerobic and endurance training. It could be swimming, modified swimming, which we'll talk about in a bit, water walking, maybe water running, shallow or deep water aerobics, depending on what the person is able to do and their ability level. And we utilize, for people with MS, American College of Sports Medicine guidelines for aerobic and endurance training. And you can perform a graded exercise test to get really specific numbers on how many minutes to warm up, workout, the intensity level that you need to work at, possibly learning how to use a rate of perceived exertion scale, RPE scale, to be able to determine activity levels more efficiently, how many minutes of, the workout phase itself, but then how to progress that workout phase to meet the 15 to 60 minute or at least 15 to 20 minute recommended minimum for aerobic activity 3 to 5 times a week. This demonstrates a non-impact, non-weight-bearing deep water program. The slide on the left shows a gentleman doing cross-country ski leg. On the right, jumping jacks. Then also swimming. There are a variety of ways to help somebody swim if that's their preferred method of getting aerobic activity. You can see on the right the gentleman, he does better when he has flotation around the middle to be successful at doing his laps, and uses fins to help with leg strengthening and also to give his legs a little more power. Resistance training, strength training, is to improve muscular power and endurance. And resistance training and aerobic training work nicely together and help. Resistance training helps with endurance work and vice versa. So the aquatic environment lends many options for resistance training, just from the utilization of the viscosity of the water. The person can often increase resistance using that thickness of the water to make it a more resistive activity for them. That could be a strength training activity. Adjusting body surfaces and levers, so meaning if you walk sideways in the water, that might be make it a little easier to slice through the water and less resistance versus turning forward, walking forward through the water where you have more surface area. You can also increase surface area by having short levers, longer levers, so having bent legs versus straight legs, bent arms versus straight arms may increase the difficulty of an activity. So the shorter lever would be easier, the longer lever to move through the water would be more difficult. So those are all activities that are done totally just by using the properties of water. And you can enhance that with equipment, and there are tons of different types of equipment out there. Mitts and paddles, fins, buoyant dumbbells of different buoyancies, noodles, aquatic therapeutic and or bands, and there will be some pictures at the end of this webinar of different equipment to give you an idea. And again, we go by the ACSM recommendations for resistance training at least 2 times a week. 8 to 12 repetitions are recommended, light to moderate loads, and the ability to be able to complete a full range of motion. However, a person with MS may be weak and deconditioned and may need to begin with only 3 to 5 repetitions, and that is a good place to start if somebody needs to modify in that way to be able to participate. And I also think with MS, people, they talk about working out to the point of volitional fatigue. And maybe when we start to see quality of movement decrease and fatigue symptoms increasing, that maybe that's when we terminate the strength activity for people with MS.
And Michelle, is there any difference in terms of the resistance that you would incur in the water versus the land in those recommendations? Do you modify any of the recommendations because you are in the water?
Well, somebody may find because of the resistance of the water, the viscosity of the water, that maybe they can't do as many repetitions of a particular activity. But I think that can be modified with each and every activity that you do.
Right.
So these next couple of slides are showing some strength training ideas. The lady using the kickboard is working on leg strength, being able to straighten the knee down to the floor. And this is because she tends to work or walk in a very kind of crouched position. So being able to stand upright and strengthening those quads is an important thing for her. Utilizing the board is increasing that surface area, so it's making that activity a little more difficult than just pushing the leg down to the pool floor. That board could also be used for strength and mobility training of the ankle, partially because of buoyancy and partially because of the surface area of the board. So you could work the knee or the ankle in this activity. On the right is this is a diagonal sit-up in the water, and this gentleman is working his oblique muscle when he's doing this activity. The slide on the left, the photo is just working more frontal plane, rectus abdominis, aquatic abdominal exercise. You can also do activities like core stabilization, Pilates, we call it, utilizing a noodle or dumbbell for trunk stabilization as well. You can work lower abs as well as upper abs very efficiently in the pool. And sometimes I find for people they have less back pain doing their abs in the pool. The lady on the right is utilizing paddles, so that will be an arm strength activity. But as she does this, she's also working balance and core stabilization, because as she moves those paddles up and out of the water, it's going to try and push her backwards in the water, and she has to be able to balance and stabilize her body to not fall backwards. And in the corner, I'm going to point out that pink and purple square. That is an aquatic step, and that can be used for strength training as well, balance activities, and you can utilize steps in the pool as well for the same activities, being able to stand on one leg and lift yourself up. However, an aquatic step allows you to move that piece of equipment to whatever water depth that you want for that particular person. Flexibility and stretching. And so recommendations are for stretching at least once a day, and for many people with MS, they have to stretch multiple times a day to get the best effect. This is a way to help manage the symptoms of spasticity and loss of range of motion, possibly due to inactivity. So consistent stretching can also really enhance a person's ability to be able to participate in functional tasks, standing, transfers, walking, rolling, turning, bed mobility. All these things can often be easier once a person is adequately stretched. Stretching is often easier in the aquatic environment, again, because of buoyancy, hydrostatic pressure, and viscosity. Again, all these aquatic properties, they all work nicely together often for somebody to enable them to do an activity easier. Stretches can be performed statically at the wall, or you could do something more dynamic away from the wall as well. Again, Watsu is a way to stretch as well, but you have to have a giver and a receiver in that instance. So for some of these people, they would not be able to stand up and bend over without the water, the buoyancy of the water, and then maybe using the wall for stability. So maybe they get a better stretch in this position. The hamstring stretch on the right is just showing that you can also do stretches in the deep end as well, and they can be modified. But there's all sorts of stretches that you can do at the wall. The next technique or skill set that we're going to look at is adapted swimming. So as a person's ability to move changes, so does their ability to safely, independently swim or move in the water. So an aquatic therapist needs to know how to modify a stroke to maximize the person's ability to move through the water if they want to participate in swimming, and to decrease the amount of restriction that they may have because of physical abilities. So it can change which strokes you choose due to the body shape, their ability to float and balance, a person's ability to consistently clear their face for breathing. That's an important skill. And so often people want to swim on their backs because their face stays clear. But if we utilize goggles, earplugs, snorkels, teach people how to use these pieces of equipment, they may be really happy, and it may be a more appropriate stroke for them to do, say, a crawl stroke or a breaststroke, something like that. Strokes that are more symmetrical, like elementary backstroke, may be easier for somebody who has poor balance in the water to perform because they won't roll as much. A person can also alternate between arm and leg strokes or kicking to decrease fatigue as a way of being able to participate. So I told you we would look at a longitudinal rotation via the Hallowik techniques, and this is that rotation. So what this lady is doing is she's trying to roll from her stomach onto her back, and that was one of her barriers to be able to do laps, which was her goal. This lady used a power chair. She had no volitional movement of her legs, very little of her trunk, and very limited arm motion. But she really wanted to swim. So she needed to be able to roll over onto her back whenever she needed to take a rest break, or when she felt like she needed to take maybe a more substantial breath. And here she is rolling over. This had after some training, so now she's independently rolling, and she was able to do that. And that was thrilling for her to be able to swim laps on her own. Games, we incorporate games into our groups, and it's a great way to increase interaction between people and fun to an exercise program or a group setting. We do aquatic volleyball. We actually use a balloon because the balloon moves a little bit slower and people are able to get to it easier, relay races, red light, green light. So when we're looking at these activities, even the hokey pokey and crack the whip, they all work on balance. They can work on strength. It works on core stabilization activities, eye-hand coordination, and people don't even realize that they're working on therapeutic skills while they're having fun. The next section that we're going to look at is aquatic exercise equipment. And since there has been such a resurgence in the popularity of aquatic exercise since the 1980s, there's also been just a boom of different exercise equipment options that have come out on the market. And so we use equipment for support, to assist somebody to be safe in the pool, or to be able to perform an activity, or to increase the difficulty of an activity. So there are some considerations when you're purchasing equipment. Some of the equipment is fairly expensive, so we want to look at durability of the equipment. How long is it going to last? Can the equipment be utilized for more than one activity? Instead, if each piece of equipment only is used for one activity, then it may not be a good buy for you. Safety, participant safety using the equipment is really key, as well as ease of use. Can people get gloves on? Can they don and doff vests or flotation belts and things? The other thing to think about when you're purchasing equipment is having an area to store it, having an area to be able to dry out equipment in between uses, and then the equipment is going to need to be rinsed and cleaned on a consistent basis. Aquatic exercise equipment also includes access to the pool, so it may require that a person utilizes a wheelchair if it's a long walk from the parking lot into the dressing room or the dressing room into the pool. We can also, there are aquatic wheelchairs that you can use to enter a pool or exit a pool if there's a ramp. And a pool may have one or all of these entry access styles. Typical, the ladder on the side with the steps in the side of the wall. For some people, that's a real balance challenge and a hazard. Steps with railings can also be used, a ramp and or a lift. And ideally, if you have all of those options, in my mind, that's the best for entry access. Pool attire. Most pools require a bathing suit and not street clothes, and partially because street clothes tend to get dirty, and that clogs up filters in the pool. The same thing with pool shoes. If you are going to wear shoes in the pool, they need to be dedicated to the pool so that you aren't dragging all sorts of dirt into the pool and making it dirty and clogging up the filter system. And pools help protect feet on the deck as people are walking to and from the pool and also in the pool. Sometimes I've utilized socks on people's feet in a pool where it's not too slick on the bottom so that they don't scrape their toes if they're trying to move. There are pool or swimsuits. There are tankinis for women that may be easier to get on and off because you have a top and a bottom and it looks like a one piece. If a person wants that style of suit, and it may be easier to get on and off for somebody if they need to use the restroom or the toilet while they're in their suit. There are also some suits out there that are designed to wrap around and Velcro that are supposedly an accessible suit. The use, we've mentioned this earlier, of neoprene vests, jackets, shorts, and trousers. can keep somebody warmer in that cooler environment or outdoor environment. And sometimes these jackets and vests are a little easier to get on and off than maybe a traditional wetsuit or a cat suit. But they are useful. Here is a picture of a couple of my volunteers and a participant on a hydraulic lift being used to get her in the pool. And the next few slides just are pictures to give you some ideas of different equipment you may want to think about. And again, this is not an exhaustive list of what is available, but it may give you some ideas of some equipment that you want to have in your aquatic exercise toolbox. The left slide shows some different styles of neck collars, different lengths of dumbbells, and dumbbells come in all different buoyancies depending on if you're using that for support, balance, or resistance training. It would change which dumbbell and buoyancy you might use. The aquatic belts are used for abdominal work. They could be used during Bob Regatta's work. And the ring on the left might be an option for somebody who can't hold on to a dumbbell to be able to balance or stabilize that leg or arm. On the right, you see a different style of flotation vest. In these two pictures on the left, you see some resistance training equipment. You have the drag paddles that can be used for swimming or balance activities. The aqua pin in the middle, the red with the two little wings. They're nice because you can put them around the wrist or the ankles. So for strength or resistance training of arms or legs. The mitts, there are all sorts of different kinds of mitts, ones that zip on both sides, ones that just have a Velcro wrap around. Depending on your client population, you may choose a different style of mitt. There are ones that are just neoprene or lycra, but those are a little more difficult for somebody to get on their hand if their hands don't move as well. The TheraTubing and the TheraBand are both aquatic, TheraTube and TheraBand, and I utilize those because the pool chemicals seem to really eat through some of the land-based tube and bands that I've tried. On the right are a variety of different cuffs to be used. This could be used with to help somebody be able to lift a leg for walking, to do a deep water program with the blue vest with the straps. It could be used for Watsu work, for Bob Regatta's work. So again, a variety of different types of techniques for each piece of equipment. On the left, you see some noodles, and there are quite a variety of different buoyancies of noodles as well. So depending on if you're using it for a balance activity, for flotation in the deep end, as kind of a stabilizing bar, the amount of buoyancy you use, you'll have to figure out if you want a very buoyant noodle or less buoyant. If you get too buoyant of a noodle, somebody may not be able to stabilize themselves for an activity. The pink board is a Wonder board. The blue board is a kick board. These can be used for swimming, but can also be used for balance activities. Especially on Wonder boards, you can use either, but the Wonder board's a little more stable, a little more buoyant for sitting, kneeling, standing activities. And then our last slide here is showing just a variety of pins and flippers, short ones and longer ones, different widths and lengths depending on the person's abilities.
Well, thank you, Michelle. That was a very informative presentation, and I'm sure very beneficial for the viewers watching and listening to the program, and hopefully interested in working with MS patients in some type of aquatic exercise or therapy session. So absolutely fantastic job. Thank you so much. This does conclude our program, Advancing Knowledge of Aquatic Exercise in MS. And I would once again like to thank Michelle Harrison for her time and expertise, as well as our sponsor, Genzyme, a Sanofi company, for sponsoring not only this webcast, but many other additional projects and educational pieces, including the booklet that many of these slides come from, that can be found on swimforms.org in the healthcare section, professional section. So, Michelle, once again, thank you so much.
And Peter, I want to thank you and MSAA giving me this opportunity to present this webinar. As I said, it's two things that I really enjoy as part of my physical therapy career. I also want to thank everybody who tunes into this webinar for your time and attention to this information. And if you would want to ask questions or want to get in touch with me, you could through the Rocky Mountain MS Center in Denver, Colorado. Thank you so much.
That's great. And once again, thanks, Michelle. It is very obvious that you have a dedication and a passion for this topic, and we thank you so much for your expertise tonight. That does conclude our program. On behalf of MSAA, I want to thank you for joining us and wish you a great night.